I'm Shannon Weber. I'm the coordinator of the Bay Area Perinatal Aid Center based at San Francisco General Hospital.
And I'm Lauren Poole. I'm a family nurse practitioner with BayPAC. And in this video today, we are going to address some questions that providers get from couples wanting to achieve safe conception, in which the male partner is HIV positive and the female partner is HIV negative.
Great. So how can a provider counsel a couple about what their options are?
All safer conception options begin with an undetectable viral load for the male partner. Undetectable viral load is required if couples seek the services of a fertility clinic, and is recommended if couples use timed intercourse with or without PrEP.
And undetectable viral load, or this treatment as prevention, how does that work?
Treatment as prevention refers to the HIV-infected partner being treated for HIV and having an undetectable viral load. There was a very large international study done of heterosexual transmission of HIV. In this study, there was a 96% reduction in the rate of transmission from an infected partner to an uninfected partner if the infected partner was on medication, had an undetectable viral load for 6 months, and had no sexually transmitted disease.
Great. So some couples consider timed intercourse with or without pre-exposure prophylaxis, or PrEP. Can you tell me about that?
Yes. Timed intercourse refers to a couple having unprotected sex only during the time of the month when the woman is most fertile or when she's ovulating. And we advise couples to use an ovulation predictor kit in order to know when that time is. The couple then has sex a couple of times that month and then returns to using condoms again consistently after that. Some couples choose to use PrEP, which is an antiretroviral medication for the uninfected female partner.
You mentioned an undetectable viral load. How do you know or find out that the man has an undetectable viral load?
Ideally, in this situation, it's the best if we can work with both members of the partnership, the male and the female. Frequently for us, the female is our patient, and if we're able to see the male partner, we obtain consent from him to obtain his medical information from his provider. Mm-hmm. And then we continue to work closely with his provider while the couple is trying to conceive to make sure that he stays on his medication and that his viral load remain undetectable.
Once a couple is pregnant, what kind of follow-up and testing do you counsel?
Well, once the woman is pregnant, we still want to make sure that she remains HIV negative. So once a woman is pregnant, some couples opt to stop having intercourse. Others opt to return to using condoms on a regular basis. Others opt to use PrEP, and others opt to use PrEP and condoms. Those are the various scenarios that couples choose in order to keep her healthy. During pregnancy, we would continue to test the woman and, as I mentioned, the male for his viral load, and also to test the woman periodically for HIV. Pregnancy is a time when women are at increased risk for acquiring HIV, and if a woman acquires HIV during pregnancy or lactation, there's an increased risk of transmission to her baby. So we would continue to monitor her for HIV infection during pregnancy and lactation.
And then what about in the setting where the woman doesn't get pregnant?
So if a couple fails to conceive, that would be the time to consider initiating an infertility workup. There's no requirement to institute an infertility workup before such a couple attempts to conceive. Mm-hmm. In some cases, you might do some infertility assessment initially, but it's not necessary. Depending on the age of the woman primarily, you might initiate some infertility evaluation after several months of trying to conceive, or after a year of trying to conceive.
So some couples want to know also about assisted reproductive technologies, and so this is sperm washing with intrauterine insemination or sperm washing with in vitro fertilization. We don't have those services at our clinic. They're available at fertility clinics. Cost and location can limit access to that, but we cover that in more detail in a pamphlet on our website. Can you tell me about your success with this approach?
Well, I'm thrilled to report that in the past 10 years, we have not had an infected baby born in our program, nor have we had any sexual transmission to a female partner.
We have more information for both patients and providers on our website to support HIV-affected couples in realizing their sexual and reproductive health desires.